Today, we will be going over the cardiovascular system. In this system, we will be describing the anatomy of the heart, the blood vessels, electrical activity of the heart rate, stroke volume, the cardiac output, blood supply to the heart, blood pressure, factors affecting resistance to blood flow, hypertension, and hypotension.
Hey guys, so today I'll be talking to you about the cardiovascular system, starting with the anatomy of the heart. The heart is located in the center of the chest cavity. It is composed primarily of cardiac muscle tissue and is the approximate size of a large clenched fist. The right and left sides of the heart function as two separate pumps. Each side contains two separate chambers separated by valves that only allow blood to flow in one direction. The upper chambers are called the atria and receive blood returning to the heart. The lower chambers are called ventricles, and these receive the blood from the atria and pump blood away from the heart.
Now that we have given you a brief overview of the anatomy of the heart, let's start with some questions to see how much you've remembered. What function does the atria perform? A. Pumping blood away from the heart. B. Maintaining body temperature. C. Receiving blood returning from the heart. Or D. Maintaining pH. The correct answer is C. Receiving blood returning from the heart.
Next are the blood vessels. The arteries are blood vessels that carry blood away from the heart, and the veins and blood vessels that carry blood to the heart. The capillaries are very small blood vessels that serve as the sites for exchange of materials such as oxygen, carbon dioxide, and nutrients between the blood and the tissues. The average diameter of a capillary is 7 micrometers, where 1 micrometer is equal to 1/1,000,000th of a meter. Between the arteries and capillaries are the arterioles, which help distribute blood flow throughout the tissue. Finally, the venules connect with the capillaries to the veins.
Now that we have given you a brief overview of the blood vessels, let's try some questions. Which are the blood vessels that carry blood away from the heart? Is it A, the capillaries, B, the arteries, C, the veins, or D, the venules? The answer is B, the arteries.
The next important function of the cardiovascular system is the electrical activity of the heart. Nearly all of the cardiac muscle cells are contractile cells that do the mechanical work of pumping blood. However, a small number of what are called autorhythmic cells have a peculiar but nonetheless important property, namely, initiating and transmitting nerve impulses that cause the cardiac muscle to contract. Interestingly, the autorhythmic cells are capable of sending rhythmic nerve impulses by themselves. Cardiac cells responsible for autorhythmic behavior are located in 4 areas of the heart. These areas include the sinoatrial node, SA node, the atrioventricle node, AV node, the bundle of His, and the Purkinje fibers. The SA node is considered the pacemaker of the heart because its resting rhythm is about 70 pulses per minute, the normal resting heart rate, and it dominates the slower rhythms of the other autorhythmic cells. The coordinated interaction among these cells is responsible for contraction of the heart chambers. However, lack of sleep, anxiety, and certain drugs like caffeine, alcohol, and nicotine can affect the coordination of the SA node with the other autorhythmic cells.
Now that we have explored the electrical activity of the heart, let's try some questions. What does the SA node do? A. Maintain pH. B. Control blood pressure. C. Cool off the body. Or D. Become a pacemaker. The correct answer is D. Becomes a pacemaker.
Heart rate, stroke volume, and cardiac output are several mechanical measures of heart function. Heart rate is the beats per minute of the heart, and as mentioned above, is approximately 70 beats per minute at rest, established by the dominance of the SA node. Stroke volume is the volume of blood pumped per beat or stroke. Cardiac output is the volume of blood pumped by each ventricle per minute and is the product of heart rate and stroke volume. Suppose that your resting heart rate is 70 beats per minute and that your stroke volume is 65 millimeters per beat. An easy calculation shows that your total cardiac output is 4,550 milliliters per minute, or 4.55 liters per minute. A not-so-easy calculation shows that over the course of a year, your heart pumps over 2 million liters of blood per year, but this only represents the blood pumped at rest. During exercise, your cardiac output can climb between 20 to 40 liters per minute. Clearly, your heart can be considered the workhorse of the body.
Now that we have gone over heart rate, stroke volume, and cardiac output, let's look at some questions. What is stroke volume? A. Volume of blood pumped per beat. B. Volume of blood pumped by each artery. C. Beats per minute. Or D. Beats per hour. The correct answer is A. Volume of blood pumped per beat.
The next function of the cardiovascular system is the blood supply to the heart. At rest, the heart only demands about 3% of the total cardiac output to the body. However, as do all living tissue in the human body, the heart requires a steady supply of blood that contains the necessary nutrients and oxygen for metabolism. Branching from the aorta, the right and left coronary arteries are responsible for delivering blood to the heart. Blood supply to the heart depends on changes in oxygen demands. During exercise, the oxygen demands are very high and the blood supply to the heart is increased primarily through an increase in dilation of the coronary blood vessels. Coronary artery disease, however, can impede the blood supply to the heart. An inadequate blood supply to the heart may lead to a number of complications such as cardiac pain, called angina pectoris, or actual damage to the cardiac tissues.
Now that we have discovered what the blood supply to the heart is, let's answer a question. At rest, what percentage of the total cardiac output does the body demand? A. 7%, B. 9%, C. 5%, or D. 3%. The correct answer is D. 3%.
Blood pressure. Blood flow throughout the circulatory system must be maintained at desirable rates at all times so that oxygen and essential nutrients are delivered to the tissues and waste products are removed. The flow of blood, F, through a vessel depends on two major variables: the blood vessel's pressure gradient, dP, which represents the difference in pressure from one end of the vessel to the other, and its resistance, R. The following expression represents this relationship in a quantifiable manner. F equals D times P over R times 3.2. Blood flow always moves from areas of high pressure to low pressure, much like the flow of water through a garden hose after opening the faucet. Following the contraction of the heart, pressure is high at the beginning of a blood vessel and the pressure is low farther away from the heart. Because of this difference, or gradient, in blood pressure, the blood flows through the blood vessel from the region of high pressure, nearest to the heart, to the region of low pressure, farthest from the heart. We can say that blood flow in a vessel is directly proportional to the pressure gradient because as the dP increases, F also increases. However, the above expression also indicates that blood flow in a vessel is inversely proportional to increasing in the resistance of that vessel. So the higher the resistance or hindrance to blood flow, the lower the flow of blood through the vessel. Factors affecting resistance to blood flow. A few factors affecting resistance to blood flow would be blood viscosity, vessel length, and vessel radius. Viscosity is the resistance to flow of a fluid. Blood viscosity is therefore related to the thickness of the blood. If the blood viscosity increases, resistance to blood flow through the vessel increases. Excessive increasing in the number of red blood cells results in higher blood viscosity. Vessel length and its radius also affect resistance to blood flow. As blood flows, it makes contact with the inner walls of the vessel. The greater the surface area of the contact, the more the resistance to blood flow. Therefore, the longer the vessel, the greater the contact area, and thus the greater the resistance. In addition, the smaller the radius of the vessel, the greater the resistance. Because for a given amount of blood, there is more contact with the inner walls of the vessel. The last thing I will be talking about today is the hypertension and hypotension that can be found within the cardiovascular system. The term hypertension means an unusually high blood pressure, which can be over 150 to 90 mmHg. And hypotension refers to low blood pressure, which can be below 100 over 60 mmHg. Chronic hypertension puts undue stress on the heart and the blood vessels. Patients with this disease may suffer from hemorrhages of small blood vessels, leading to bloody noses, retinal damage, or even severe stroke. Hypotension may result from heart failure or loss of blood volume, to name just a few of the causes. Essentially, severe and sustained hypotension results in an inadequate blood supply to various tissues and organs and leads to a number of serious complications, or in severe cases, even death.
Now that we have made it to the end of this video, let's answer one last question. What is hypertension? A. High blood pressure. B. Perfect blood temperature. C. Natural blood temperature. Or D. Low blood pressure. The answer is A. High blood pressure.